Okay, good afternoon, ladies and gentlemen. Let's call the meeting of the Rutherford County Benefits and Insurance Committee to order. You have received minutes from the previous meeting. Do we have a motion concerning their approval?
Motion to approve.
Motion, Dickerson, and second from our friend, Mr. Hefner. Any questions? Did anyone have any changes or corrections or additions? If not, everyone in favor of that, then please say aye. Aye. Any opposed? Okay, thank you. All right, first we'd like to introduce our new committee member. We have Miss Michelle Watson, who has asked to join us, and we're happy to have her with us. She's been in the insurance business about all her life, 15 years. So anyway, she's with the Willis Towers Watson firm. She has her life and health insurance license, and she's a client manager or marketing manager at the broker level. So we're just happy to have her with us and look forward to you working with us. All right, next, Mrs. Street will tell us about our financial condition, please, and I think you have some of that information contained in your information on your table.
Yes, sir. I have both the June and July report. Before we begin, I'd like to give the committee an update. Earlier in the year, we had awarded a contract to Benefit Focus, and as part of that contract, I had indicated to you that we would be modifying our reporting package. I'm disappointed to say that through the implementation process with Benefit Focus, we were unable to achieve the goals that we had set forth through the bid process, and therefore we have terminated our contract with Benefit Focus. We are in the process with working with Willis Towers Watson on a new report presentation for you all. We expect to have that in place and rolled out to you at the next meeting. So you will be able to see additional reporting that you've not seen in the past. It will be presented to you in a slightly different way, but I think it will in the long term be more meaningful to you in terms of understanding where we are in actual to budget, looking forward into the next renewal year, which is always our fun time as committee members. So I did want to share that information with you prior to going into the reports today. So if you'll look at the reports that have been provided for Fund 264, we'll begin with last fiscal year's report for the month of June. Within the month of June, for our self-funded claims, we ended on a per employee per month basis of $817 compared to prior year of $995. For a year-to-date average ending fiscal year of $951 compared to prior year of $897. Combining our on-site medical clinics, our per employee per month ended at $848 compared to prior year same time of $1,064 for a fiscal year end of $994 compared to prior year of $934. I've also provided you a report for the current fiscal year. In the month of July, our self-funded claims ended at $1,080 compared to prior year of $894. Combining the on-site medical for the month of July, our per employee per month increased to $1,116 compared to prior year of $931. In addition, I provided you with a report that shows a calendar year comparison to a fiscal year comparison. And on this report, I'll just focus you in on the third line, which you will see is the calendar year period. And it gives you a revenue versus expenses. As you can see right now, we have higher expenditures than our revenues, which is not uncommon for this time of year, and that equates to how premiums are collected on a 10-month basis within the Board of Education. We should see that level out once we begin to collect those premiums again in September. You'll see an influx of revenue at that time, which typically offsets any deficit that we have been experiencing.
Okay, does anyone have any questions for Mrs. Street?
I can present Fund 266 if there are no questions.
Okay, please continue.
For the month of June, within Fund 266, we ended at $702,183 compared to a prior year of $657,661. And for Ms. Watson specifically, I know that the others are aware, but this is our on-the-job injury program, and so that's what these numbers reflect within Fund 266. For the month of July, within our Fund 266, we ended at $22,764 compared to prior year of $53,534.
Any further information or questions? All right then, thank you very much, Ms. Street, for that presentation. I don't know whether I should say anything else or not, but on this benefit focus, which we had high expectations on, and they were unable to deliver, and we made a decision that we thought it would be wise for us to get out of there before we invested mega dollars in something that wouldn't work. So that's what happened, and we did have a small expenditure to get this thing over with, but I think we're far ahead of what could have happened if we had not chosen to extricate ourselves after much due diligence and good documentation of all the difficulties that we did experience. So I'll just say that on behalf of the risk management team, they suffered through this with some anguish, but I think we're better off to move forward and try to do something else that would be more productive. Okay. All right, Mr. Goode. What about workers' comp and OJI, the OSHA report? Well, yeah.
Good afternoon. I'd like to report in the month of July that we had a total of 14 injuries requiring medical attention. From your report there, you can see the breakdown. That brings the year to total from January 1st to the present, 100 injuries. 57 of them are OSHA recordable. Of those 57, 28 were restricted days, 15 lost time days, and 14 all others. On the next page, you'll see your graph. You'll see that compares this year to the two previous years. We're down slightly from last year and about 20 accidents down from where we were 2 years ago. Following page, you'll see where we are on the incurred dollars, where of course we're down from last year, but about the middle of the road where we were 2 years ago. In the month of July, the total incurred dollars were $37,671 for the 14 injuries that we had. They were broken down. 2 of them were at the Board of Education at $6,950. Remember that the month of July, the Board of Education was out for summer break, so that's why they're down so much. And the County General had a total of 12, and the dollars incurred for the County General is $30,721. The last page of your report, you'll see where we broke down the County General to the different divisions, and they're listed there so you can see the breakout for those 12. Are there any questions?
Okay, if there are no questions, thank you, Mr. Goode. So we're on about comparable track with the last 2 years. We're
Yes, sir.
about in the same position. Is that a fair statement?
Yes, sir.
All right, thank you.
Thank you.
Okay, Ms. Kelli Perrien, wellness, please.
Hi, this is the wellness report for June and July. We went to new hire orientations at the Board of Education in both of those months and have had several Wellness on Wheels events where we go to the county departments and set up and talk to them about the MedPoint clinics and the HRA assessment, the biometrics that are due in September. We touched we had conversations one-on-one with 270 employees in June and gave 100 goodie bags out to staff on top of that. And in July, we talked to about 539 people and handed out 167 goodie bags at county general departments. Our current wellness campaign deadline is September 30th. We have about 35 days left to get our biometrics and HRA completed to Cigna. We are at 1,608 completion. So we have about 6,500 people that we're still waiting on to get going. That's kind of broken out underneath that. You can see there are portions, 1,353 have not taken their HRA but have done their blood work, so they just have to do their online portion. There are 650 that have taken the online portion but not got counted for their blood work. MedPoint has done about 677 biometrics this month in August. They have almost 300 that they are still processing with provider review and getting that information to Cigna. So we do have, a little bit more time, but we're hoping that people hurry up and get going, because the MedPoint lines, they have the same amount of staff in September. So we just encourage you to take advantage of their extended hours. Blackman and Walter Hill have openings for walk-ins 7 to 11 on Saturdays, and each weekday they are extending walk-ins from 6 to 7:30 at various clinics. Tuesday from 6 to 7:30 is Blackman, Wednesday is Stewart's Creek, and Thursday is Walter Hill. Chelsea Maddox is here and joining us for Premise Health. She's the new wellness coordinator and one-on-one coach there. She's already seen 28 new people this month. She just started August 8th, so she has definitely hit the ground running. She's at a Wellness on Wheels right now at Rock Springs Middle, so she has just gotten right in the frying pan, is doing really well. And we are excited to have her. This June and July on this report is wrapping up Miss Patricia's numbers. She had 3 initial visits, 43 follow-ups for a total of 46 one-on-one coaches through the MedPoint Clinic this summer. Our current and upcoming fall activities, our Touchdown to True Wellness is the 3rd quarter countywide wellness program. And we're going to start registration September 1st. Lifestyle management class, we're going to have a recipe swap for football, tailgate, and appetizers that are healthy versions on 9/13 Community Center at Lane Agri Park, 5. We have a heart walk at St. Thomas Hospital. They host that event, and we want a big county presence there. They're starting at 7:30. The walk starts at 8. Life Services webinar for September is Effective Communication with Children. It's online and on demand. On September 20th, it will be available for you. So like I said, our assessment, Know Your Numbers campaign is due at the end of September, and our wellness fair is scheduled for 10/14 this year. Anybody have questions?
Perrien, before you leave, I just want to make a couple of comments, and I can feel the anxiety from Ms. Barnes in the back, so I want to make one comment. Beginning in September, we will start with frequent reminders, a minimum of once a week. We have been sending out monthly reminders to date. I do want to congratulate Ms. Perrien as well as Mr. Puckett and Ms. Maddox. They're working very hard to get into all of the schools prior to the deadline, to meet with the staff, be available through the Wellness on Wheels, educate them, help them get their assessments where they need to be, so that we do have the information out there and readily available for them, so that they can be successful. We are running the extended biometric hours. We have added staff for those, Ms. Asher Branner, yes, that's correct. So our regular staff is not increasing, but for the walk-ins, we do bring in individuals so that we can expedite that as quickly as possible. I know just the other day down at Stewart's Creek, we did 100 biometric screenings in that one, it's a couple hour period, I believe. And so people are, they're coming in, but true to nature, regardless of how long we give them, they wait to the last minute, and we can only process so much at one time. And I think that's what Ms. Perrien's point was. But we will begin those frequent communications, getting all the forms out. We have someone on site in our office that can assist. I know with the highway department, on Friday, we see their folks coming in to get those done. And so please just help us with that messaging out to your departments to get this taken care of.
Like Mr. mentioned, in the last years, we have gone to Wellness on Wheels throughout the school year. This year we've scheduled them all before the deadline date. Daniel Puckett with Cigna is taking his laptop and doing assessments at each school. Anybody that comes in and wants to do the assessment, we do it right there on site. So and actually handing them a piece of paper with the extended hours, talking about the MedPoint Clinic and encouraging them to do their screenings.
And your growth in terms of the numbers of folks that are coming to these Wellness on Wheels, they've grown exponentially, have they not? I believe that's what we had talked about.
Yeah, absolutely.
Okay, so what's your feedback, Ms. Barnes, on that?
These numbers are alarming because the bulk of those employees belong to Rutherford County Board of Education, and I know you guys have done as much as you can to put this information out to them. I just will ask, and thank you for that update, that when you do send out those weekly reminders starting now, that we include the Cigna form if they go to a private position, the clinic extended hours, the fact sheet again on how to check their points, because those are the 3 questions that come up so often that I have to forward into you. So as long as we can explain everything as clearly as possible and send it out again, and I'll make sure we send it to the principals of the schools to address those people that may not check their emails as frequently as classroom teachers do. So thank you very much.
Any other questions for Ms. Perrien? So if they don't do this, what is the penalty?
It's a $300 payroll deduction for 2017. For Board of Ed, it is in 10 $30 deductions, and County General has 12 deductions.
Harlan?
Remind me, it's been a little while since we've had to talk about this. So we didn't change anything this year. We just moved the deadline up a little bit before the wellness fair.
That's right. So we had an overlap previously of our open enrollment period and the end date for the Know Your Numbers campaign. We discussed it after last year's open enrollment. It was felt that there was some confusion about the deadline dates as to what was due when, so we wanted to have this date end sooner so that that is already taken care of for the current year, and then they're only focusing on open enrollment in October.
And so are we seeing, is there better return this year? I mean, are we ahead of the curve than we were last year?
I can't say specifically. I can tell you that the numbers feel lower than what we have seen, but we do know that the last 30 days, which we are just about to enter into, always is where we get the bulk of participation.
All right, anything else for Ms. Perrien? Okay, then, thank you very much. All right, we're talking next, it says OJI actuarial evaluation. So who's handling this for us, please?
That's me. You have a form in front of you. It's a comparison of projected ultimate losses. About every 2 years, we will have Select Actuarial Services provide us an actuarial evaluation of our OJI program compared to what we would have experienced should we have remained in a traditional workers' comp arrangement. So what you will see is a comparison in front of you of July 1st, 2015 through June 30th, 2016, and then the following fiscal year of July 1st, 2016 through June 30th, 2017. As you will see, the bottom 2 numbers in each of the categories, projected ultimate losses and workers' compensation, demonstrate to us again that the OJI program proves to be a very cost-effective solution for Rutherford County, with a ending number of $385,000 in ultimate losses estimate for the OJI program compared to the $2.2 million we would have experienced through a traditional workers' compensation program. For the current fiscal year, we expect numbers to end at $467,000 within the OJI program, compared to the $2.1 million we would have experienced through the workers' compensation program. I've been with Rutherford County for 6 years now. When I came, there was a myriad of complaints about the OJI program, quite honestly. We have worked very diligently. Mr. Goode's put a lot of work into education, as well as client management, the client being our employees. And I can tell you that today, very rarely do we receive any complaints about the program. Now, you all may hear it in the field, but I think that as a whole, we've worked very hard in revamping the program to be more customer focused, to make sure that we're taking care of the employees and that we're getting them back to work. And the numbers reflect that it was a smart move for Rutherford County, and the complaints reflect that we are doing a good job in terms of managing the program and taking care of the employees as well. So I wanted to share this actuarial evaluation with you all, just to keep you up to date on how the program is progressing.
And Ms. Street, do we have our actuarial person actually with us back there?
No, sir. That's Ms. Asherbranner from Premise Health, and she is lining up to come up next.
She was just getting ready for the next agenda item.
She has information she's anxious to share with us today. So,
I mean, I don't know if the person that did this work, have they shared any other actuarial studies they've done with any other counties? There's only one or two others, or maybe a few more, that even have OJI. So how do we compare to them? Does anyone know?
I haven't seen anything along those lines. Ms. Nolan, do you recall anything like that? Okay.
So the two of us are the only two we know. Okay. Well, this is pretty remarkable to see these low numbers here, which has been a remarkable program that we've put in place, and it's working. That's a good thing. Okay, so that being said, I suppose we are now ready for Premise Health Review, and you may introduce who's going to discuss that with us.
All right. So we have Miss Mary Asherbranner approaching the podium. She's going to share with us the business review for Premise Health as it relates to the MedPoint clinics. She's the Senior Operations Director, and she is my go-to person within our relationship with Premise Health. And so, Mary, I'll turn it over to you and let you go through your report.
Thank you. And thank you for allowing me to present to you today. It's not often that I get up in front. I normally stay back in the back and go, yep, that's right. Uh-oh, that's wrong. So, opening in on the executive summary, this is just basically the first quarter, looking through on what our accomplishments were. We'd completed the 2015 biometric program, which we had ended last November, but we're finalizing everything through the first of the year. We completed the spring wellness event. We reviewed our prepackaged medication with the providers and the vendors, and this is something that we do because we provide prepackaged medications. I'm fighting with the mic, so if y'all can't hear me, let me know. We review the prepackaged medications that we provide at the clinic because those are given to the patients, the employees, when they come, when they've seen the provider at no cost. But we want to make sure that the formulary is up to date and it is appropriate for what's being seen and the services that we're providing. The key focus areas that we'll be working through for the year 2016, we're doing additional biometric collections in April. We did that earlier this year at Sturts Creek for the biometrics. We did a sports physical day where we had designated one Saturday at Sturts Creek that we did nothing but sports physicals for the summer. We're finalizing the wellness class schedule for June. So these are wellness classes that are at night on Tuesdays. And so this is for those individuals that are through their counseling or they're waiting to do their counseling with the wellness coach, and you need something to hold you until we can get you in, or to help you progress and stay focused after your counseling has been completed. Those classes are up and running, and we've had a good turnout, especially during the summer for those. We expect that to increase this fall. We are finalizing the summer schedule for the biometric collection starting in August, because we moved everything up earlier than what it was previous to last year. So that's why we have the extended hours at the different clinics on Tuesday, Wednesdays, and Thursday mornings, and have added the additional staffing on Saturdays at Blackman and at Walter Hill to do nothing but collections. So we will be seeing patients on Saturday at those two clinics like we normally do, but then have additional staff there to do nothing but biometric draws. Of course, the health fair is scheduled. The flu vaccine is ordered. I'm happy to say that part of the flu vaccine is already in, ready to go. So, and we have our staff notified and set up so that we can have enough staff there so that when we do the flu shots at the health fair, then the lines are not quite as long and things run fairly smooth, which we hope to mirror what we did last year, which I think was the best yet. Okay? And then we have a flu vaccine clinic set for Stewart's Creek and Blackman, and that's the 2 weeks after the health fair. So we will be giving the flu shots on a walk-in basis from October the 17th, the week of the 17th, and the week of the 24th for those 2 weeks. Any questions about that? Okay. Our next one is just the metrics dashboard, and so this is through the first quarter of 2016 on it, but just to show you that the total encounters are tracking very similar to what we had done previously in the past. The top 5 diagnosis categories by quarter, which are down on the bottom left, you'll see that in the fourth quarter of 2015, the preventative services are extremely high, and that's related to those biometrics and things that we are doing. And acute respiratory infections, upper respiratory tract problems are also rate high. But then hypertensive disease is actually high enough that it pulls into the top 5, even with the preventative diseases with the biometrics. So we are focused very much on the hypertension, the diabetes, and the hyperlipidemia, which are the 3 large diagnoses that we want to focus on. Our penetration rate continues to track as it did the same as last year. And then the bottom is just the net savings summary for the first quarter, which when you're looking at the net savings for 2016, we were at $350,000 in change as compared to $352,000, which is tracking almost identical, I think, in the counting world. Okay. So the next one is partly, I wanted to include this slide because it's the specialty referrals. And this is important to you to show you what the clinics are doing for your employees, because year to date, 1.6% of all the provider visits resulted in a referral to a specialist. This is less than what the community referral rate is. The community referral rate is about 9.6%, and we're tracking well below that. And that means that our providers are taking care of the employees in the clinic. It's not saying that they are not doing the referrals if they're needed. That's far from that. They send patients to referrals for referrals when they're needed. But if they can manage them on site, then that's what you want to do. One perfect example was we had a patient who it was diagnosed with a blood clot in the leg, a DVT. Ordinarily, most of the time in some of the walk-in clinics, they would refer to a specialist. We're not a walk-in clinic, we're actually a clinic. Dr. Dooley is a board-certified internal medicine specialist with a subspecialty in pediatrics. Blood clots are her thing, okay? Which is a good thing because she's been able to work with our nurse practitioners and get their skills to the level that we were able to manage that DVT within the clinic. They didn't go to her for referral. They didn't have to spend time in the hospital. They were appropriately cared for with the right medication, like they should have been. Now, if it had thrown up red flags and been critical and passed Dr. Dooley's skill, they would have been sent wherever they needed to go. Okay? If you'll go to the next slide. The next one is the year-to-date performance guarantee results. And one of the things that we were talking about when we bid the contract and we're doing our presentation, we brought the fact to the table that we had performance guarantees set up and they were in place. This was not something that Rutherford County specified that they wanted. They didn't ask for it in their bid process. But it's very important to Premise Health because this lets you know that we're doing what we're supposed to be doing, and we're putting money on the table that says if we don't, then we're not going to be paid for certain things. So, I wanted to bring you up to date. September the 2015 through March 2016 is what this covers. There's our performance guarantees. We're looking at acute bronchitis. And this just says with acute bronchitis, this performance guarantee stated that antibiotics were given at the appropriate time. Statistics show that with acute bronchitis, the practice of care is not to give antibiotics right off. It should clear itself within a matter of time, and only if certain red flags are present, then those antibiotics are given. That's good patient care. It's sort of hard when somebody comes in and says, I want an antibiotic, and clinically you're not supposed to. So we follow good clinical guidelines. At this time, we're at 100% of that performance guarantee meeting that requirement. The hypertension screening and the diabetes screening states that we will give them a referral to the Cigna Wellness Program. Okay, that really doesn't sound like much, but it does because that's putting the information back in their hands for programs that Cigna has available to the employees at no cost and making sure that they are getting the information they need to improve their health and wellness in a combination with us, the clinic. We're at 100% of notifying those patients of those services. The patient satisfaction goals. And this one, I get to grin about. The clinics have a challenge among themselves to see who's the best. And it's a little bit hard to say who's the best when you're actually averaging 4.7 to 4.9 on a 1 to 5 scale. Of course, Walter Hill has everybody beat. Okay? Stewart's Creek is at a 4.7. They handle most of the walk-ins. And Blackman is a 4.8, which is right in the middle, and that's where we're supposed to be. Our PG was a 4. I'm extremely proud of the customer service and the care. The next one is the client satisfaction, and that is how well are we supporting Rutherford County from a corporate perspective. And you guys have graciously rated us a 4.4. So overall, we are looking at the next one on our budget. And this says that to be at 80% to meet my PG, I have to keep my budget at 107%. Where we are actually at your budget right now, at the end of this time, was at 97% of the budget, providing the services that we needed to provide for you, okay? And when I checked the budget to actual the other day, coming through the end of July, I'm still sitting at about 97.6% of budget. So that is, I feel like that I am doing what I need to do administratively to make sure that the services are being provided, but knowing at the same time that if I need to provide anything, then we're able to do that, okay?
Ashley Brenner, I mean, maybe, let's just go back to one, for example. Patient satisfaction.
Yes, sir.
If I'm reading this correctly, you've set a threshold on a scale of 1 to 5 at 4.8, and you've exceeded the 4.8 because you're at 120% above that. Is that?
When on the PGs, when you're at 100% contractually, and the way it's set is, then there's usually bonuses paid back to Premise Health for those services.
So the goal was a bit less than 4.8, but you exceeded whatever your goal was by, instead of being at 100% of your goal, it was 120% of whatever you had set as an outcome for a result. Is that fair?
That's correct. The goal for the patient satisfaction was a 4.0, and we did a 4.8.
Okay. So the people turned in follow-up ratings at 4.8 as opposed to your goal of 4. All right. So next year you're going to raise your goal to at least 4.5 or 6, right?
No, I'm going to keep it at 4.
You all use an outside firm for that calculation, correct?
Yes, we do. We use Sullivan and Llewellyn, who is a third-party vendor, and so those surveys in previous years have been manual on a form that you go in and you fill out. And then part of last year and earlier in this year, we're actually taking a laptop and they're actually filling out a checklist right on the computer, and it's immediately tracked. So we don't see those results. We don't know what they're writing, okay, until we get the results. Okay, which is cool.
So the performance guarantees are a big deal for us, and this is the reason why. When we had clinic takeover, we had to dispose of a lot of medications that had expired, that were not being utilized regularly, which is why we often review the formulary at least once a year to make sure that we are ordering and stocking and utilizing the prescriptions that we have, so we don't have that loss that we've seen in the past. The budget was not being maintained under prior contracts. And so all of these areas are really targeted towards deficits that we have seen previously. And she's explained, that they are actually meeting, in most instances, exceeding the performance guarantees that we have in place that were put there, these specific categories, as roadblocks for lack of performance that we have experienced and that we don't want to experience, going forward. So. Good job.
So on our the patient satisfaction survey, I brought out the 5 key questions at the very end of the survey, which is the next page. And I broke it out by each one of the clinics. And understanding this is a rating scale of 1 being unsatisfied and 5 being extremely very satisfied. Was your patient experience, and this is talking about the overall experience that you have when they are visiting the clinic. And you can see there, Blackman was 4.82, Stewart's Creek was 4.76, and Walter Hill was 4.92. And then, how well did our staff work together as a team to care for you, okay? And again, you can see 4.81 to 4.97. And then please rate your experience with our worksite health center compared to other medical offices. So this is saying, are we that different from the other offices that you're at, or is the experience equal or better? And we're at 4.7 to 4.88. The likelihood of returning to this worksite health center for medical care, that is key. They need to look at the clinics as we are truly a medical clinic. We provide care for you, okay? So I said, this is not a walk-in clinic. The score is 4.70 to 4.96. And then the likelihood of recommending this clinic, I had a good experience, yes, you need to go there. 4.73 to 4.96. So our overall average, as you can see, was running from a 4.72 to a 4.92 for a 4.8 overall. This is, to me, a validation of the services and the care that the providers are giving and the staff is giving at the clinics.
And if you all will recall, when we were going through the spousal eligibility change, one of the numbers I had provided you all was a penetration rate for the MedPoint clinics. And at that time, we had looked at individuals who had utilized the clinics more than one time, assuming that some may just go get their biometric screening there. And for those that had used the clinics 2 times or more, we were at a 64% penetration rate at that time. So a lot of our employees are utilizing these clinics. And this would be indicative. These scores are of people who may only use it twice or who may use it regularly, like myself. So.
Okay, that reflects a very good job. I think Ms. Asher Brandon, maybe I'm off base here, but Stewart's Creek,
Yes, sir.
every one of these 5 components is greater than 4.76. Therefore, your average of 4.72, I think you appreciated yourself.
I see that now.
All right, thank you. All right, continue on.
So the next page is just patient testimonials. And this is examples of patients who have come in and the care that's been provided and the outcomes. So one patient came in with leg pain, no other symptoms or risk factors. They were diagnosed with a DVT. It was a blood clot in their leg. They were treated in the clinic. A patient presented with pain in the side and they ordered a chest x-ray. It was suggested by the radiologist to be cardiomegaly or pulmonary vascular congestion and edema. They were sent for a CT scan, they were diagnosed with a lymphoma, and referred to Vanderbilt Oncology. So if the referral is needed, it's done. But it's the fact that they were there, it was picked up on, and they were moved to the appropriate care. The next one was a patient has uncontrolled diabetes and obesity for 15 years. And over the past year, working with Dr. Dooley and the wellness coach on lifestyle changes and insulin adjustment, the BMI changed from 51 to 44, which is very good. That's the body mass index. And the hemoglobin A1C decreased from 10% to a 6.1%, which is exceptional. And so one of the main focuses, and this is the last slide, the main focus that I have for the clinics in 2016 is actually being truly a medical home for the patients, the employees of Rutherford County. And right now what we're seeing that 30% of the employers are offering workplace clinics in medical homes. 40 to 60% of those visiting on-site clinics do not have a doctor in the community, so the clinics are their home. And we're seeing that at the MedPoint clinics now. They don't see anybody else in the community. We are their home. 60% of the employers that do not charge copays or deductibles at the clinic. So there's not any charge if they have the Rutherford County insurance for the services that are provided at the clinic. And we're on track and trending with the other companies that are providing the same services. And in 7 to 10 years, most primary care will be outside of the traditional community doctor's office. So outside of the traditional community doctor. So the MedPoint clinic is not the community doctor that you would normally see, that had been the backbone. But yet, as we are providing services to Rutherford County employees, their spouses, and their dependents, then we are becoming that. So we have a unique group of providers that are providing care for the Rutherford County employees, just the Rutherford County employees. Okay. Does anyone have any questions for me?
Stevenson has her hand.
Ms. Stevens.
Yes, ma'am.
I just have a couple of questions because I want to make sure I understand. On the second page where it says your focus areas for 2016, number 4, it says that you're finalizing your summer schedule and additional hours defined and orders placed for additional staffing. Is that staffing that's already included in our contract, or would that be something that will be billed for?
It's already in your contract.
Okay. Then the page where it says program trending facility utilization, that top graph, it goes 0, then 1%, 1%, 2%, 2%. I guess I'm not used to seeing them be together. Like I would think it would go 0, 1, 2, 3, 4.
It is 0, 1, and should be 1.5, 2, 2.5.
Okay, so on page 4, it should go 0, 1, then 1.5, then 2, then 2.5? Okay.
Yes.
All right, and then my last question is on page 5, where you're talking about the participation in the performance guarantees.
Yes.
Does every patient participate, or is it by like choice participation? You said that they complete it when they're there. Do they complete it when they're there, or do they get sent something later to participate in?
Okay. The patient satisfaction survey, that is presented when they come into the clinic. So we're not sending it out to their home and expecting them to send it back to us. They are there, and they go in, they see the provider, their ask is on their way out now with the iPad. Would you take just a few minutes and fill out the patient satisfaction survey? They can fill it out, or they can say no.
But it's during a block of time. It's not ongoing throughout the year. It's during a block of time that
Correct.
you all do the survey process.
So what she's saying is it's not ongoing all year long. The patient satisfaction survey, we were doing it once a year. We do it twice a year. Once at the beginning of the year in the February time frame, one in the fall of the year, September to October.
So how many of the patients that come into the clinic would you say participate in this survey?
We do a minimum, okay? We have a minimum that we have to do, try to do 100 surveys per site, okay? And as a general rule, we have made that almost every year except for one, and that was the year that last year we did not get quite 100 at 2 of the sites, but that's in the middle. Our patient satisfaction survey came right in the middle of the end of the biometrics, and there was no way that we were able to ask them to complete a survey when they were in and out to get those biometrics done as quickly as possible.
Okay.
Biometrically, right now, if we're coming into the last month and we do what we did last year in the last month, we did about 1,700 biometrics. If we do 1,700 biometrics in the month of September, we will not be but a little bit over half of what the total biometrics needs to be done. What I need for you to do for me is to go back to your sites, and those that need to get the biometrics done, make sure that they know that we're there, what our hours are, and get them in to get it done.
Ms. Stevenson, just to answer your question a little bit more, we average on a monthly basis about 2,300 appointments. So 300, you'd have 300 surveys out of that 2,300 minimum that you would expect to see completed. Yeah, I'll just add the number while you're looking at that.
All right, thank you very much. Mr. Marlin, you want to ask a question?
What year are we in the contract? Is this year one?
This is year one of the second renew, of the first renewal. I get it. So this is the 5th year that we have worked with you guys.
And how many more years is in our current contract?
We start September is the start of the 2nd year, and there'll be a 3rd, with the right of renewal for an additional 2.
Okay, thank you very much.
No question?
Report.
Okay.
Right, other business from anyone out there? Or Ms. Street, do you want to give them any heads up on anything that's coming soon?
Last month I had indicated to you all that these type of meetings would be coming to an end, right? Because we're going to start doing some real work in here. We've got several bids that will be going out at the end of the year. Next month, I will present to you an overview of the open enrollment materials, as we generally do prior to those being mailed out. We'll also start discussions about our retirees and what their cost spend is. As you know, our pre-65 retirees incur a large portion of the retiree spend rate. That's why we resulted in blending those rates with the actives. We've passed a couple $1 million on into those active premiums that we are now blending to have consistent premium pool between the actives and the pre-65 retirees. And I'm just going to provide you with information on different ways that we can provide that pre-65 retiree coverage that will lower both their cost and Rutherford counties. And we'll start that process next month.
Any other questions from anyone? Okay, then, thank you very much. We are adjourned.